So one of my passions, both from a research as well as from a public health standpoint, is foreign body aspiration and ingestion, and that's what I'm going to talk about today. So aspiration, this is a great child. He's not the typical child who aspirates because he's a little bit older, but you can see that he's choking on something. And another thing that I'm going to tell you today, I'm going to give you a whole bunch of numbers. And I don't want you to keep track of the numbers too much, because I think if we add them all up, it probably adds up to more children that there are in this country. So you will feel like you can never leave the emergency room because there are tens of thousands and hundreds of thousands of kids. Everybody's choking, so it's amazing that we all survived. But these are the real numbers, about 17 or 18,000 ER visits per year in this country alone for choking accidents, 200 fatalities a year, and this is probably even a little bit higher. So that's almost one a day, one every day or two. There's a death from a choking accident. The majority of the kids are young, so the 1 to 3-year-olds are who we see most frequently. Again, they can be younger than a year, and certainly there can be older than 3. There was a death recently in Massachusetts, an 11-year-old choked and died on a marshmallow. So again, we talk about food choking risks and which foods are the most dangerous ones, and again, we're talking about for toddlers, but certainly anyone can choke on any food object or any object at all. For any of us who've gone to the toy store recently or looked online for a toy, or if ever seen a toy, and probably a lot of you grew up when these toys were labeled, there are a lot of guidelines regarding safety of non-food items. So there's labeling for toys, labeling for objects, but there's almost no labeling for food choking risks, which is pretty amazing if you think of that. Food is what we eat, what we put in our mouths. Toys are not, but the foods are not labeled for safety. So who chokes? It's a little more common in males, although this is a very slight difference. And again, children under 3, it's most common. The most common location, assuming that it goes low enough beyond the upper airway, is going to be the right mainstem bronchus. And again, food is much more common than non-food as far as a choking accident. Seeds and nuts are the most common, and peanuts are the most common food. But when I was doing these projects on food, I soon learned that peanuts are not nuts. Probably many of you know that they are legumes. So they don't really count even in that nut category. They're a separate category. And this is the key thing, again, for interns, students, residents. Most choking accidents are witnessed. So that's, where you dial 1-800-HISTORY and you get a good history for these families, because you'll have a kid with a cough and you may be going down one avenue with respiratory infections, chronic colds, chronic coughs, asthma, wheezing. But if you get a really good history about a prior choking event, and by prior, I could even mean up to 6 months prior to when you're seeing this child, that could be the event that triggered a cough. So it's not necessarily a child, and here's where you say, well, I learned what a sick kid is, I learned what a not sick kid is. A lot of the kids who've had choking accidents are not sick kids. These are kids with chronic coughs, chronic wheezing. And again, if you get a good history, you can find out that they actually had a choking event many months prior. So again, the young children are the highest risk. Why is this? Well, they're the ones on the ground, and for any of you who've ever had someone child-proof your house, usually the child-proof person will come over and crawl all over your house, and that's the level of these kids. They're looking at the ground, they're crawling, or they're just little people. They're 2 feet tall, so they're going to be at that level. So they're the ones that are going to be picking things up off of the ground. Eating is no longer an activity. We don't have yogurt, we have Go-Gurt. It's something to do while we're on the move. And kids too, they're eating while they're doing other things. They're eating in the car, they're eating while they're at the doctor's office, they're eating while they're at the playground. So they're not attentive to eating itself, and that puts them at a higher risk as well. Many of them don't have molars, and even if they do have molars, their reflexes and coordination are very immature, so they tend to choke more. Their airways are narrow. Next time you see a patient, look at their pinky. That's about how wide their airway is. So they're very tiny airways, and these objects can get lodged at any level. And young kids like to put everything in their mouths, whether it's their own thumb, whether it's other objects, teething toys, food, not food, they put everything in their mouth. So these are the kids, again, who are at highest risk. So how do these kids present? And they're not necessarily going to come in to your clinic or to the emergency room and say, hi, I just choked on X, Y, or Z. But oftentimes there is a witness choking event that's not necessarily seen as an acute problem, because oftentimes they will choke, cough, and then seem fine. And they can seem fine for minutes, hours, days, or even weeks, or even months. So again, it's sometimes a very delayed presentation with these food aspirations especially. They may have shortness of breath. They may be stridorous, where you can actually hear noisy breathing. If they do have stridor, then the object is probably high in the airway, either at the level of the vocal cords, right below the vocal cords, in the trachea itself. If it's lower down, meaning beyond the trachea into the right or left main stem bronchus, again, usually the right, you will hear a wheeze. And this can be intermittent, because the object can move, have what's called a ball valve effect, and not necessarily be fixed in one area. And oftentimes it's unilateral. Kids don't get asthma on one side. They do get pneumonia on one side, but they don't necessarily have unilateral asthma. So if you hear a clear wheeze on one side, then you want to think about a foreign body. And again, the cough could be intermittent. So if you get a good history and find out that they've choked in the past, you may want to look into this. If they're retracting, suprasternal or high retractions, it's a very high foreign object, and that's more of an emergency situation. Intercostal retractions, usually the object is more distal. So chest x-ray may or may not be helpful. Again, since most kids are choking on food, we're not going to see the food object on a chest x-ray. Oftentimes the x-ray could be abnormal, but sometimes it could be a normal x-ray, so don't necessarily be fooled. We talk about something called air trapping if there is an obstructed bronchus, or pneumonia if it's a very delayed foreign body that's been sitting there for several months. They can actually develop a pneumonia or even an empyema. To order a left lateral decubitus, you'll better see the air trapping. Again, the majority are on the right. So again, if you hear right-sided wheezing, you think about a foreign body. And that's part of the reason that it's more so on the right, is the angle of the bronchus is more obtuse in relation to the trachea, so it's going to go straight down on the right side. So this is what an x-ray can look like. Again, you can see some asymmetry and air trapping on the right, but it's not always this obvious. So again, the majority are food. Again, if you look at any toy, it's labeled for safety, but food objects are not labeled for safety. Seeds, nuts, and legumes. And part of the problem with these objects is they swell if they're sitting in the airway. So if a child aspirates, say, a sunflower seed or a sunflower seed shell, which is very common, the seed will swell in the airway, and their symptoms may progress over time if it's sitting there. So what about fatalities? Most kids actually don't die, thank goodness, from food choking accidents. Most of these objects are small and they pass distally. But the large food objects, hot dogs, are actually the worst culprit. That's the highest risk of fatality from older kids, is from hot dogs. There was a case in Arizona not too long ago where a child, I believe he was 8 years old, choked and died at lunchtime in the cafeteria on a hot dog, and they pulled hot dogs from the school system after that. So hot dogs are a real big danger. Baby carrots, I hate that name because they're not for babies. Those little fake, not fake, but those little carrots that look like your pinky, that look like a child's airway, they're perfect. So, they're fine to eat, they're healthy, they've got all good things in them. But I always recommend to sort of heat them up and cut them up. May lose a little bit of vitamin A, no big deal. But, to give a child a whole carrot is really dangerous. Whole grapes, another really bad one. Even for older kids over, I usually say at least until age 5, the grapes should be cut and even peeled, but at least cut into quarters or into thin little slices. Gel cup candies, I don't know if any of you remember those. They were these little cups of candy. They're about this a little bit bigger than a grape, and you put them in your mouth and you aspirate them. It's perfect. And there were several deaths, unfortunately, in the LA area when they first came out. Several of them in Torrance because they were selling them there a lot. And these weren't necessarily infants, these were a little bit older kids. So those were actually pulled from the market, but I think they're back on the market. And then this is I hear it from my patients, so I know they're getting them, these Dum Dum lollipops at the pediatrician's office. And it's a great name, Dum Dum, because they are. Those spherical lollipops are just perfect for a child's airway. And so I really recommend not giving them out, because what happens, the child is in the doctor's office, they get a shot, they're crying, they walk out, they get a lollipop, they eat it in the back seat of the car. And if it's a child who's now 2 or under, they're going to be rear-facing in the car, and so you're not going to see what's going on with that child. So I really don't like, those flat lollipops are fine, but those spherical lollipops are really dangerous. So again, hot dogs give the highest mortality in older kids, again, kids even up to age 8. And I just, some of the food objects will have a warning label. So you can see here, there's this warning label, children under 4, I would say 5, but 4, that's still fine. Cut hot dogs lengthwise, crosswise, bite-sized pieces. Well, what's amazing is there's no warning about this, because this is actually pretty disgusting. So you can have this mechanically separated turkey and you won't choke on it, but I would just say avoid hot dogs, but I'm no fun. Baseball teams won't like me. So what do? You get called to the emergency room, and there's a question. They have a known history of choking accident. If the child's in distress, just call us, and they go right to the OR. We don't even necessarily stop and get a chest X-ray. Some of these kids are in quite significant distress. Some of them may actually become obtunded, and we take them right to the OR. If we're concerned about a high foreign body, meaning at the upper trachea or at the level of the larynx, we usually have a trach set open, because again, these foreign bodies swell, and even if we can see the foreign body, we sometimes physically can't get it through the vocal cords because it's filled the airway so much, so we'll have to make a temporary tracheotomy tube placement just to get the foreign body out. Again, we have it set up for an emergency bronchoscopy and a tracheotomy tube just in case. And then we always admit these kids, even if their breathing is great right afterwards. There can always be some delayed swelling of the airway, some bleeding, some post-op pulmonary edema if we're all of a sudden relieving this upper airway obstruction. So we usually keep these kids overnight at least. And this is a typical setup, just to give you an idea of how we take these kids to the OR. So this is actually in a tracheal tube, but it's not in the child's airway. We call it insufflation. So it's just giving a little bit of anesthetic, inhalational, as well as a little bit of oxygen. But here's the laryngoscope. And the child, if you notice, is not intubated. They're breathing spontaneously. So we never like to paralyze kids who are having any sort of airway procedure, because we like them to maintain their own airway. And then we would put the bronchoscope through the laryngoscope here and take out the foreign body through the mouth. And again, if we can't, then we would open the neck to get the foreign body out. So what about legislation? I'm going to talk a little bit about this. It's not so glamorous and glitzy, but I think it's really important, especially for those of you starting out in practice, just to know what is available to patients and what they do and they don't know. So back in 1979, the Federal Hazardous Substance Act was enacted, and this was where they had that small parts component. Many of us remember when that started, and that was through the Consumer Product Safety Commission. It was not through the goodness of their heart. This was a regulation, and it regulated that all products were labeled for safety for children under 3. And so that's when you see that little circle on the toy with a cute little kid with a curly Q and a line through it. So that is a law in this country that all toys have to be labeled for safety. And then that small parts test fixture, that little cylinder, it's about, if you go like this, it's about a little more than 1 inch in diameter and about 1 inch in length. If any part can fit through that, then it's deemed unsafe for kids under 3. And then the Child Safety Protection Act in 1995 regulated that even products coming into this country, even if they were not manufactured in this country, had to be labeled for safety. And then they expanded it to spherical balls, so Dum Dum lollipops, but they're food, so they're not labeled. But any ball that is smaller than 44 millimeters, or about 2 inches, has to be labeled as an aspiration risk. So this includes super balls, marbles, magnets, any sort of spherical object smaller than 2 inches has to be labeled. And then also any latex balloon must be labeled. The reason why latex balloons are so dangerous, not just for latex allergy, as we know for the hospital, but once the balloons are at the party and they pop, and those little fragments are on the floor and they're all different colors, kids put them in their mouth, they suck them in, and they sit right on the top of the airway. So those are very high risk. Actually, they arbitrarily picked age 8. Not safe for kids under age 8. And then marbles also are labeled for safety for 8 and under. So now there's some surveillance of toys and foods, and they're keeping track of which toys are dangerous, and they pull some and change some regulations, and they label them differently. So that's been great. But there is nothing about food. And again, food is what people eat. Food is what your families are going to be feeding your patients. So there's no label that they can go to the store and say, oh, I shouldn't give this to my 2-year-old, I shouldn't give this to my 4-year-old. So the Food Choking Prevention Act has been brought to Congress several times, requesting the FDA label food for safety. And it's requested that the FDA keep track of these food accidents and to report on these incidents, and it's been dismissed by Congress several times. So again, that's why it's not that the Consumer and Product Safety Commission is labeling these toys because they're nice people. This is a regulation, but again, there's no regulation for food safety. So we really need this kind of sign. This has nothing to do with allergies. This is really to do with choking risks. So the American Academy of Pediatrics, your friend, you should all join, in 2010 did issue a statement sort of regarding this inadequacy of food safety, and that the FDA should really share in this responsibility. And they do provide a lot of education for families and for physicians. If you go to their website, they have a nice list and some recommendations and also some safety guidelines about food safety for kids. So Dr. Devaskar mentioned this campaign that we did here at UCLA. There's a great sort of group at UCLA called SPARK. If anyone is interested in sort of doing crowdfunding for nerds, this is what they are, and they will help you and support you with a very brief fundraising effort that you have, whether it's for research or outreach. And so we did an EatSAFE campaign here at UCLA, and really to provide food choking awareness. We had videos, we had a website, we still have a website, and we provided brochures. They're out front. Feel free to take some. If you need more for your clinics or your offices, let me know. We made 10,000 of them, so we do have plenty. And it's really just very basic information to families, gives the list of foods, gives a lot about safe eating behavior, again, because everyone is on the go. Nobody has time to sit and eat. So we just talked to families about that, a little bit about Heimlich, back thrust, and CPR. But again, we really don't want to teach families how to save their child. We want to teach families how to prevent these accidents from happening. So this is not my least favorite. I actually love Halloween, except when I'm on call. And there is a real uptick around Halloween because of these cute little kids that are eating all this stuff. So there is a little uptick always on the night of October 31st or November 1st, because who has time to come to the emergency room that night? And these are kids because they're eating stuff they're not used to eating. Oh wow, this is colorful, this looks great. They eat while they're running. For any of us, they're eating, they see something great, or they just put it in their mouth and they're running to the next house. It's dark. They're in the car. So they're after they've gotten their goods, and you take them home in the car, and they're in the back seat. And they're under a mask. Oftentimes they're eating under a mask. So these are really sort of rough times for otolaryngologists, Halloween. I love the candy, but it's a pretty dangerous holiday. So, always really if you have patients around that time of year, always really to remind them about the safety, not just about not running in the street and not being on your cell phone when you're out trick-or-treating with your kids, but just as far as what they're going to eat, not just from there's a razor blade in the apple, but that they can choke on a candy bar. So again, some more numbers. This is a study that we did. We looked at the nationwide inpatient sample for over a 2-year period. There were about 2,000 patients admitted for foreign bodies overall. Mean age was about 3.5, about half undergo surgery. The mortality is 1.8%, and anoxic brain injury 2.2%, so 4% of either death or anoxic brain injury from food choking. Mean length of stay was 3 days. And this is one of the reasons why it's hard to get funding. It's not a really costly entity, shall we say. The median cost is $7,000 per event, and the annual inpatient cost is $12 million. Just to put that into perspective, ear infections cost about $5 billion per year. So it's a relatively low cost entity, although with a very high cost of relatively high anoxic brain injury and mortality. So what about ingestion? Oh, they swallow something, it's no big deal. So it is true, ingestion is a lot less worrisome than aspiration. Ingestion can oftentimes pass. The most common foreign object that's ingested, that's a non-food object, is a coin. The most common coin that's ingested is a penny. The reason for that is the most common coin on the floor is a penny. And most pennies will pass in children over a year. They'll be able to pass through the cricopharyngeus. Occasionally it'll lodge at the GE junction, pylorus, ileocecal valve. So you do need to tell the families that if it's a toddler who swallowed a penny, they need to monitor the stool. So many families will tell you, yes, I saw my 2-year-old swallow a penny and they're fine. But what they will probably not be able to tell you is the year of the penny, and which is reasonable, but something to just keep in mind is that pennies made after 1982 are primarily zinc. They're not copper. So if the penny does not pass, and there have been several cases of this, the very, very thin copper coating will erode, and if it's lodged even in the lower GI tract, it will have a zinc object in the GI tract, and there have been some cases of zinc toxicity from penny ingestion. So the families really, again, you don't necessarily need to go to the OR. They don't even necessarily need to be x-rayed, but they do need to document that the penny has passed because, again, they can have a piece of zinc sitting in their GI tract for a long period of time. So again, if you get a call that a child swallowed a coin, most of them can be monitored if they're without any symptoms. If they have any symptoms at all, then obviously they need to come in for an x-ray, oftentimes a full body x-ray to see where the coin is. If it's beyond the upper esophagus, oftentimes they can be monitored. If you're concerned or if the family's concerned that it hasn't passed, you can always get a follow-up x-ray. If we admit kids overnight for a larger coin, and they're in no distress and it looks like it's in the high esophagus, oftentimes we'll get a pre-op film because the coin can certainly pass overnight, and we would want to avoid a general anesthetic if it's passed on its own. Nickels and quarters are also swallowed. Quarters, very unlikely to pass. They usually sit at the cricopharyngeus, so very high in the airway. But it's amazing how kids can compensate, even adults, and swallow around these coins for weeks on end. So if you have a child with a sore throat and something's not right with their sore throat looks fine, and they're just complaining of some throat discomfort and maybe a little pain with swallowing, you may want to get an x-ray to see if there's a foreign body lodged. But the main concern for coins are not the coins itself. Again, zinc toxicity is exceedingly rare, but it's button batteries, which look like coins. And a family member may think that the child swallowed a nickel or a quarter, and it's actually a button battery. So that's a real life-threatening injury if they ingest a button battery. We had a case recently here at UCLA a couple weeks ago where a child swallowed a button battery. So again, more numbers, about 3,500 per year in this country. There's been a significant rise over the last 10 years. I don't have a laser pointer, but if I did, it probably would have a button battery in it. Toys, remotes, watches, calculators, really so many things that you have. Hearing aids, the little tiny button batteries, flashlights, key fobs. They all have these great lithium button batteries, but they're very dangerous for kids. And then the newer, larger 3-volt batteries are even more life-threatening than the older, tiny little button batteries that we would see. And even if it's a dead battery, so if a family member says, we had this old lithium battery, it hasn't worked for a year, and my kid swallowed it, but it's not an active battery, it doesn't matter, it can still cause injury. And it's the electrical charge that reacts with the saliva. and that current hydrolyzes water and breaks it down to hydroxide, which creates this severe alkaline injury within hours. It's not from an acid leak, a battery acid leak. It's actually from the electrical charge that dissociates the water. So it can happen very quickly and just in general, but any sort of battery placement, shall we say, is considered an emergency. So a nasal battery, even the small ones, can cause a septal perforation within a matter of hours. A battery in the ear canal can also cause some erosion into the canal and mastoid within several hours. So any battery anywhere, we say we don't let the sun set on a battery because those really need to be taken out right away. So for battery evaluation, it's an urgent head-to-toe x-ray, again, even if it's an ingestion and they're not in distress. If it's lodged in the esophagus, they go to the operating room right away. If it's distal and they have swallowed the battery, and again, those 3-volt batteries are quite hard to pass. They're about the size of a quarter. It's less likely to cause tissue damage if it's in the lower GI tract. And the way you can differentiate it from a coin is this halo effect. I don't know if you can see that on this film. You see it's sort of a double layer circle. You can see this inner dark area and an outer area, and then it's a little bit thicker on the lateral view compared to a coin. But again, you can see how this, certainly on the lateral, it can very easily be mistaken for a quarter or a nickel. So complications, again, esophageal injury is usually within a matter of hours, strictures, perforations, TE fistulas, aortoesophageal fistulas, which is why after we remove a battery, even if the esophagus looks okay, we usually keep the kids for a couple of days because there can be some delayed tissue injury. Vocal cord paralysis just from pressure on the recurrent laryngeal nerves, spondylodiscitis if it's extended posteriorly, and there have been several deaths. So again, more big numbers because everybody has some sort of foreign object injury. 40,000 battery injuries in the last 13 years or so, 14 deaths. And just in 2013, there were 3,300 injuries, 8% with adverse events, including death. So what kind of prevention have we made? Well, it's actually better than food choking prevention. In 2008, the Consumer and Product Safety Commission again created this Improvement Act mandating that batteries be inaccessible in toys. So that's why if you have a toy, you have those little tiny, tiny screws. So if you look at the poster for this talk, there's a screw, which is probably about the size of the screw that we're using to protect the child from the battery. So those little screws you have to be really careful with too when you're screwing in the battery for the kids' toys. And then the Button Cell Battery Act, which did not pass, would have required a warning label on any toy with a battery saying that the batteries were not safe and they need to be secured. The proceedings of the National Academy of Science had a study where they created a battery that has a protective coating where the battery would still be functional, but it would protect the any sort of breakdown of electrical current if exposed to liquid, but that hasn't been used yet. Another option, and there's a whole battery section of the American Academy of Pediatrics and our academy as well, is to mark batteries with a radio-opaque labeling, so there would be no question that it's a battery as opposed to a coin on an x-ray. Again, because a quick look at a lot of these x-rays, you'll say, oh, it's a quarter, we'll see them in the morning. So, to make a very clear marking on the batteries when you do get an x-ray that it's a battery and not a coin. What about Bucky? Who remembers Bucky Balls? Those are the best. So those are they're banned. Those tiny little magnets for older children. They're very strong magnetic force, and they can be made into jewelry, shapes, desk toys. It's like an advertisement. But they cause severe intestinal injury. And with over 3,000 ER visits, they eventually pulled Bucky Balls, and there were several deaths due to intestinal perforations. Now, that said, it's not just Bucky Balls. Again, there was a case recently at UCLA of refrigerator magnets causing intestinal perforations. So it can be any sort of magnet if more than one are swallowed. And again, these were those fun little toys. I had a patient recently who put 2 in her nose, 1 in each side, and her parents didn't know about it until they fell out and they left a septal perforation. So they're very strong. They stay for months on end. But here's what happens with the Bucky Balls when they would swallow them, and then a second magnet, obviously, and then it can just erode anywhere in the GI tract and cause perfs. And again, it's not just Bucky Balls, except these are quite small. They're very easy to swallow, very hard to choke on. And the magnetic force is quite strong, so they will most definitely cause some injury. So not only, this has some choking risks here, which is great. So these gummy candies are choking risks. This spherical jawbreaker is a choking risk. Got all this gummy stuff, this Jolly Rancher that's not labeled is a choking risk. But the point of this is that how many laundry pods are there in this picture? One, two, three, four. They're really nice. And they look like candy. And so, it's very easy to mistake these. And they make them look like candy on purpose to make them very marketable. So these are these single small use package. Again, I sound like an advertisement. And it's concentrated detergent encased in this very thin membrane. And it has this colorful candy-like design on purpose. And it has ethoxylated alcohol and propylene glycol, very similar to laundry detergent in itself. But because it's so concentrated, it causes a much more severe injury in a very short period of time compared to liquid detergent. And also because it's in this packet, a child will be sort of chewing on it for a while, and they will have a significant oral burn as opposed to drinking laundry detergent, realizing it's a terrible taste, and then putting it away. So again, the injuries have been more significant than standard laundry detergent. Here's a bigger number, 10,000 visits in the last 4 years, 4,000 requiring medical attention. Usually it's GI. Rarely would there be respiratory distress, wheezing, or facial. Now, obviously, facial burns would be higher, but they're rare to cause respiratory distress unless there's severe erosion of the esophagus or if the child aspirates the detergent after swallowing it. And it's no longer recommended by Consumer Reports, so there's been some decline. But initially, there was a very high incidence of these. Just over a 1-year period, over 17,000 children were seen for these injuries. And in that period where there was really high level of advertisement and they became quite popular, each month there was a rise by 600% of these laundry pod ingestions. The majority were young, just as with any other foreign body ingestion, over 700 hospital admissions, some intubations, and 2 deaths. So there have been significant decrease in the last few years. There's warning labels, opaque packaging. It's hard to take them out of the package now. The containers are latched. There's been some public awareness about the risks of laundry pods. And the Consumer Reports obviously has said that they are not recommended for households with kids under age 4. The other thing just to tell your families, just speaking of laundry detergent in general, is for any sort of cleaning liquid, not to store it in an unlabeled container. So if you have a little extra, you don't put it in a clear container without a label, because if there is an accidental ingestion and they do need to call poison control, they want to make sure that they know what the ingredients are so they can tell the person on the phone what it was that they drank. And also, you don't want it to look appealing to a child if it's a bright colored liquid in a nice container as opposed to a locked laundry container. So in general, we talked about foreign body ingestion and aspiration, and just a couple things to just keep in mind. Occasionally, this will be a child who was rushed into the emergency room in acute distress, but much more commonly, again, especially even for the aspirations, this will be those kids who have a low-grade chronic cough. They are wheezing a little bit, it's intermittent, there's not a clear source, it's unilateral. Those are the kids you want to think about a foreign body ingestion. Again, they can be 6 months out from the event, and it could be a food object that's been lodged there for months on end. They've been treated for asthma, been treated for bronchitis, when it's actually just a peanut sitting in their right main stem. It's remarkably common. So again, just really educate your families. Don't assume that people know what's safe. Again, because so many of these episodes are witnessed, it means that the families didn't know. And again, I see this countless times. I didn't know that X, Y, or Z was not safe for my child. I never would have given it to them if I didn't know it was safe. And for almost every food choking episode, I hear that. We had a 15-month-old who aspirated on a cashew, and the family thought they were giving him vitamin, a healthy diet by giving him cashews at 15 months. And, he almost died. So you really have to just not assume that these families know. Everybody's very tuned into allergies, which are very important in preventing allergic reactions. But it's the other stuff that people don't really think about. They think grapes are healthy. They think baby carrots are healthy. Even hot dogs somehow are healthy. But they're easy, that's for sure. But really to educate the families, and again, don't assume that they know what's safe, because again, most people don't. They can be life-threatening or certainly life-altering. And again, prevention is key. The treatment of these, we take them out. It's, we're the plumbers. We just fish them out of the airway. But, the goal is to keep these kids out of the emergency room. And then again, if there's any sort of question, if you have a kid with a cough that just doesn't seem right, and you don't have a good answer as to why it is, we always do look into a foreign body as the possible cause, and even a delayed ingestion injury. And then again, continue to educate these families, because you're sort of the first line here. New pediatricians especially, they're going to look to you because they're new families, and they may think everything is fine. And again, they don't know because nothing is labeled. They can read the labels on the toys. They can't read the labels on the foods because they don't exist. And then if you have any interest in sort of making this a larger scale effort as far as getting foods labeled, I'd be happy to talk to anybody at some point. And I'm happy to answer any questions. Thank you.